First Lady Charlene McCray is heading up the city's new racial inequality coronavirus task force because there's increased concern about the racial disparities surrounding COVID-19. It's no secret that it's disproportionately affecting African Americans and Latinos. Joining us now via Skype is Dr. Joseph Ravenell, Associate Professor of Departments of Population and Health and Medicine at NYU Langone. Thank you for joining us, Dr. Ravenell.
Thank you for having me, Cheryl.
Absolutely. So, as an expert in this field, what would you like to see come out of this new task force headed by the First Lady?
So, I think it's wonderful that the city really is taking an important look at the disparities that we see in outcomes from COVID-19. And we understand, those of us in the public health community and those of us who have been looking at racial disparities in health, we understand that what has happened with COVID-19 is really just shining a light on disparities that have existed in our country for decades. And so just the fact that we have this opportunity to not only shine a brighter light on these disparities, but that efforts like this task force are in place so that we can actually do something about them, I think is a very important step.
And Dr. Ravenell, what do you find the most alarming so far regarding the disparities?
So what has been most alarming is the fact that the proportion of COVID cases and COVID deaths, the most severe outcome, far outpaces the proportion of Black and Latino citizens within a given region. So if we look at New York City, for instance, even though Blacks make up 25% of the population in the city, they make up so far about a third of the deaths. A similar story with Latinos. We also see a similar pattern in other cities, such as Chicago, Washington, D.C., where the deaths are disproportionate in comparison to the proportion of the population that they make up. We see it all across the country. And there was a recent study that came out from the Centers for Disease Control that suggests that even though Black Americans make up about 30% of the population in Georgia, that they account for 80% of the hospitalization.
Wow. And based on what you just said, how important is testing and tracing in the African American and Latino communities?
So testing and tracing are critical to not only getting control of this disease, but making sure that we stay on top of it going forward. The only way for us to know where we stand and to know if our policies are working and to know when it's actually safe for us to think about reducing the level to which we have to social distance, or any efforts to go back to the life that we know. Those efforts really have to be guided by testing, so that again we know exactly where we stand, and so we can see if when we do start to open things up, if we see another spike, which would warrant very swift action to get things back under control.
I have about 30 seconds, Dr. Ravenell. Just tell us quickly, what role does cardiovascular disease play in this disparity?
So we are learning more every single day. What we do know is that those people who have pre-existing cardiovascular disease, in particular hypertension, those people are at risk of having the more severe outcomes, such as severe illness in the hospital and death. And we know that that African Americans are much more likely to have hypertension. So again, this is an opportunity for us to address this pre-existing disparity, which is leading to disproportionate suffering from COVID-19 in the African American community.
We really appreciate you shedding light on this issue. Dr. Joseph Ravenell of NYU Langone Health, thanks for joining us this evening.
Thank you so much, Cheryl.